Welcome back to Here and Now. Thanks so much for joining us. Well, the finance minister says today's investment in healthcare is the biggest in the province's history. But what about people living without a family doctor or struggling to access emergency care or mental health care? Well, we are going to talk about that now. Andrea O'Brien, you were born and raised down on the Southern Shore in Cape Royal, and you're invested in the community. You're a town councillor down there. We'd like to talk about healthcare in your region of the province. What's happening right now?
I guess, well, the region that we're most concerned about now is, say, Mobile to St. Shots area. In that particular region, there's a nurse practitioner who visits the clinic in Ferryland and the clinic in Trepassey twice a week. But the most concerning thing is we only have one ambulance, and that's in Trepassey. So for most of that region, our ambulances are being sent from Holyrood and St. John's.
So what does that mean for people? Give me a picture.
Well, that means if you live in Cape Royal, which is about a 45-minute drive from town, before you get an ambulance, it is, if you're lucky, an hour and a half from Holyrood or St. John's. So if you're in a critical situation, that's just way too long to wait for help. There was a recent situation this week in Fermuse. It took almost 5 hours for the call to leave from St. John's, to get the patient and go back to St. John's. I could have been in Grand Falls in that amount of time if I had left my home.
And what are people saying to you about how they feel about accessing care?
I mean, people are very frustrated. It doesn't give you much of a sense of safety, outside of those 2 days a week that there's a nurse practitioner in your area. If something happens outside of those times, you really don't know what the outcome is going to be if you have to wait that amount of time to get to a hospital. And it's so frustrating because people look at us as being so close to St. John's, but if you're waiting an hour and a half for a response, it seems like you're a long distance away from St. John's, even though physically you aren't.
Yeah. And the provincial government has made a lot of announcements before the budget, family care teams, for example, being one of them, and other initiatives in the budget today, like consolidating ambulance. When you see the budget titled Your Health, Our Priority, what do you think about that?
Well, in our region, family health care clinics are going to help. They're not in our region, so what happens is people from the Southern Shore are just further clogging up the system in St. John's, because you have to go to St. John's for all of your healthcare needs. And in terms of ambulance, and they're talking about consolidating those services even further. And I think in our case, the consolidation of services is what has created this problem, because we went from a system that was very much community-based, with businesses in those communities serving the community, to a consolidated system where there's a bigger group of companies that's providing that care, and the care is just not adequate.
Well, Andrea, thank you so much for sharing your thoughts with me. Christy Allen, I would like to bring you into the conversation. Many people know you for your demonstrations about access to long-term mental health care in this province. You're very passionate about that. Some of the first words out of the finance minister's mouth today, when she stood up to give her budget speech, were health and then mental. What does that signal to you?
For me, those are words until I see action. And I mean, she did discuss mental health care later on in the budget, but for me, you have to prove it. You can't just say it, you have to prove it.
Yeah. And what kind of gaps did you see in the system that prompted you to start your long-term demonstration in the first place?
It was two things. I had a friend who I believe if she had better access to long-term mental health care, she wouldn't have passed away. And also it was the news of someone who had died by suicide, and I just became extremely frustrated and decided I was going to do a long-term demonstration for a long-term problem.
Mm-hmm. And do you think enough money is being put towards mental health when you take a look at this budget?
As of the last time I saw the total numbers, and I'm actually very curious to see the total amount spent on mental health care, because they committed to 9% of the budget by 2022. And last time I saw the numbers, which was fairly recently, it was 7.6. If 9% of this budget is towards mental health care, it should be $351 million. I'm very anxiously looking to see if that is going to be the total amount.
Mm-hmm. And does this budget hit the mark for you?
Not from what I see right away. Obviously, there are some good things, but I am concerned about the FACT teams and how they're getting 4.4 million when it was 8.9 million in 2022. Now, there might be a reason for that, but I would like to know why that number is so much lower.
All right, well, Christy, thank you so much for sharing your thoughts with us this evening.
Thank you for having me.